who is this for, right?
Yep.
Who is this campaign advocating for? What are you guys seeing, and what would you like the viewers to know about that advocacy?
Thank you. Yeah, so the Natural Medicine Health Act, first and foremost, is for individuals who are currently suffering from things like major depression, PTSD, extreme anxiety, end-of-life distress. So many folks who are seeking these medicines right now are looking at them from a palliative care perspective because they're suffering from like a stage 4 cancer.
Yeah.
And to help with that transition, knowing that potentially in the near future they may be severed from their mortal coil, right, and their body, and to find peace in that in that reality. Now, what we're not doing is that we're not requiring that a person has any kind of qualifying condition to be able to access these natural medicines. So you don't have to have major depression or extreme anxiety. There are certainly some cases, and arguably for a lot of people, if you're a quote-unquote healthy, normal person, which I think Michael Pollan coined that term in his book, How to Change Your Mind, like these natural medicines also work for healthy, normal people. In the sense of like providing more insight or more integration into their experience of being human. So first and foremost, knowing that we have this mental health crisis in the state and we have a veteran suicide crisis right now, we want to make sure, and the measure and the model reflects that we want to make sure that these natural medicine services are available to as many people in Colorado who could possibly benefit, especially those who are suffering from mental or behavioral health conditions. Which is why, what's so tremendous about this model as well is that we're not only advocating for the creation of healing centers, but also talking about integrating the availability of these services with currently existing healthcare locations like palliative care, like hospice, like addiction treatment centers. And so, over the course of the 2-year implementation period, if this passes, we really do look forward to being in dialogue with so many folks across the state who want to see these become more accessible, and then especially if you're already working with patients who are suffering, like how do we bridge that 70% gap? And like you said, we're comfortable enough with the tremendous amount of clinical research that's happened for these natural medicines in the past 20 years to say, look, like if this is something that can work, let's try it. And let's see what we can do to integrate these services into our healthcare infrastructure, and in some cases normalize using natural medicines, again, like psilocybin mushrooms, for folks to be able to heal.
Yeah.